Good.
Did you test the mic already?
What's up, y'all? It's Dr. Mia and Joseph at Mibella Wellness Center, where we offer gynecology for women and adolescents, as well as weight management, hormone pellet therapy, total wellness with solutions, intimacy services, and laser hair removal for both men and women. Our goal is to help you live well, age well, and experience everlasting intimacy. So as y'all know, I'm a board certified gynecologist, and Joseph will introduce himself as well.
That's all you can say?
It did the whole introduction.
Okay. And I am Joseph Brown, the Bella Men's Health, Wealth, and Wellness Coach. There you go.
And today we're going to be talking about intimacy for couples.
Intimacy for couples.
Intimacy for couples. So things that we can do to improve intimacy in our relationships and to make sure that we maintain healthy intimacy in our relationships, with some focus on physical intimacy, but also, realizing the importance of all the different forms of intimacy.
Okay, great. Just real quick. I want to test something real quick, just to be sure we are being heard. Testing. Yes, we're being heard. Okay, great. All right. Yeah. So we're talking about intimacy for couples, and as if you've been following us for some time, we deal with everything that has to do with couples when they go to intimacy and couples relationships. So tonight we're going to talk about intimacy for couples, and just what are some of the things that we should be looking for when we talk about intimacy. I think personally, the way to have great intimacy is to have great communication. Mm-hmm. To be sure that you have great communication between you and your mate, spouse, partner, and make sure you communicate what intimacy is to you. Some people think intimacy is just physical, and it's not just physical. It is intellectual, spiritual, emotional, and recreational. So, and there's and some of that, and if not all of it, can lead to physical intimacy. But it's very important you communicate what's intimate to you. What makes things intimate to you. And a lot of different ways of doing that is through knowing what your love languages are. Mm-hmm. Because the love language kind of covers spiritual, intellectual, recreational, physical, and emotional. By how, if you know what the person's love language is. And the key to the love language is know the person's love language.
That you love and love them the way they like to be loved.
Right.
And what we normally naturally do is, you don't want me to say anything?
No.
Okay.
You just finished my sentence. So go ahead.
Okay. Yeah. Never mind. What I was going to say is that normally, I forgot what I was going to say. So go ahead.
But no, you finished my sentence. I was done after that.
Uh-huh.
So knowing the person's love language and speaking to them and treating them in what their love language is, and vice versa.
Yeah, because that's what I was gonna say. I'm sorry, because what we normally do is we love people the way we like to be loved. So for my love language, it really has a lot to do with words of affirmation. So a lot of times I will give Joseph a lot of words of affirmation, like "Thank you so much for doing," but that's not really how he loves. So that's good for me. I think we all should show each other all different forms of the love languages. However, making sure that you really focus in on how your spouse or your significant other feels love, so that you can give them a lot more of that, so that they feel more love.
Right. So we're talking about intimacy for couples, and some of the different ways we can get to intimacy. We just talked about key way is first communication, also knowing your partner, mate, spouse, love language. And then a different type of intimacy, again, is engaged in intellectual, recreational, spiritual, and emotional, and physical. So, and a lot of, like I said, that usually, if you're doing all that, you usually are leading up to physical anyway.
Yes, unless, you're starting to get into that aging phase and that midlife and beyond, when things start to change, including your hormones. It may not be anything going on negatively in your relationship. It could simply be that your hormones are off, and as a result, your libido has decreased and you haven't really recognized it. But like Joseph said, that communication component. So if you are the person that's not experiencing that, and you're noticing that your partner is not as in tune to intimacy or interested in physical intimacy, having that conversation, communicating to your partner what you really need so that y'all can get on the same page. And then if you're over 35 or 40 and starting to notice a decline in your desire for intimacy, going to the doctor, getting your labs checked, probably going specifically to a hormone specialist, because a lot of doctors don't really delve into the hormone levels of men and women and, the symptoms associated with it. So, addressing that component as well as your total wellness, because with age, the desire for intimacy can decrease, but there are things that we can do to improve that. So that's physical intimacy. It can change for different reasons, but taking the time to really focus in and communicate and, speaking to your partner's love language is going to play a huge role. And then understanding that as we age, our bodies age and we change and our hormones change. So if we feel like, it's really a lot to do with hormones because you're having a decrease in desire, a decrease in sensitivity, so it's difficult for you to reach an orgasm as a man or a woman, or if you're noticing that you're also tired and fatigued and having mood changes and joint pain and belly fat and hot flashes and night sweats and problems with sleep, all of those are signs of changes in your hormones. So again, seeing a hormone specialist, getting your labs checked, balancing your hormones, all of those things are going to help improve intimacy in your relationship. And then once your hormones are balanced, then, other things can also affect intimacy, like change in blood flow. So what does that look like for men? So, as far as intimacy and age, Joseph.
I don't know. Let's back up for a second because, we got to get through the intimacy part first, but you talk about change in blood flow. That's a lack of the erection,
Mm-hmm.
but, we got to get to that point, in the first place. Like you said, if there isn't any intimacy, then you obviously got to get things checked. But at the same time, it could be just more than hormones too. It could be your hormones, but it could be just the fact that you're not communicating with your spouse on how you want to be intimate, So if it is your hormones and it's just you're going through that phase of your life, then most definitely, like Doc said, get it checked out. We're total advocates. If something's not right, it's not right.
Mm-hmm.
Get it checked out, and then if you're having a phenomenal intimate life, but in all the aspects of intimacy, but when it gets to physical intimacy, you're having some issues, then most definitely that's a conversation you need to have with your spouse as well as have with your doctor, or a hormone replacement specialist. A lot of times when we go get our hormones checked, and I just heard this weekend, to be honest, a lot of physicians or doctors will say that's normal, whatever your testosterone level is, whether it's 500, 600, 700 or 300,
yeah.
They'll tell you it's normal, but it's not normal. And even if they do consider it normal, let's say it is 600, and they would consider it normal, and they probably say it's normal based on your age is normal. If you're still having symptoms of where you have low libido and no energy to be intimate, then it's not normal, because part of having a normal testosterone level is having a decent libido and
good
having
energy.
Good energy
and focus and mood and
yeah.
memory and sleep,
Right.
all the
that,
things,
so, but as we talk about being intimate, there are several different, I don't want anybody on here or any couple to think that, your intimate life should just be physical.
Right. Yeah. So taking care of the emotional and the recreational.
So
emotional,
a lot of times,
conversations, talking about what's going on, communication, sharing your past experiences, just talking about your day, having your pillow
just
talk,
being together. Like we went to grocery store today, in the rain, because we didn't want to be around all y'all.
At the grocery store.
At the grocery store, right? So we went to the grocery store together in the rain. That is a, that's like recreational intimacy for us, because we're planning our meals and, spending time together and stuff like that, and we ride in the rain, listening to music and relaxing, so, I don't want anybody to think that, man, the physical intimacy is not there, meaning your relationship is not there. It's really important that you engage in all the other. We engage in spiritual, intellectual, emotional, recreational, and physical.
Right.
And to be honest, if you just have physical intimacy in your relationship,
it's hard for it to survive with just
physical intimacy. It's you're not happy in your relationship. Let me keep it 100 with you. So, but communicating all of that is really important. Communicating that. I like to have more conversations, or even communicate the fact that my physical intimacy is not where I need to be, and I need to express this to you so we can do something about it. Because the one reason I say express it to your partner is your partner may have insight. Well, I heard this doctor that does this. Or what's your symptoms? Well, I heard Dr. Me and Joseph talking about it. And that sounds like you may need hormone replacement therapy. Let's get your testosterone checked, And so, doing all those things, but communicating is key. Because if you're not communicating that you're having a physical intimacy issue or a low libido issue, I just don't have the energy. I'm trying to go to bed at 9:30, and she might stay up to 10:30, but I don't have the energy to stay up that late. So we can do it when she's done doing all, we work at home, so we might be working to 10:30, but, so if you don't have the energy to do that, your libido's down, or you don't have the energy, or you just lose focus, you might say, yeah, tonight's gonna happen, but you forget and do something else,
And then remembering too, like your health, if you got diabetes or high blood pressure, heart disease, if you have prostate problems, all of those things can affect your intimacy. So making sure you're doing that prevention and your screening, and that when things start to change and you notice a huge change, and like men with erectile dissatisfaction or women with more vaginal dryness and decreased sensation, making sure you address it also from the medical perspective and not just the relationship perspective. Is it something physical going on that we can easily fix to, fix the whole problem in general?
Right.
So with physical intimacy, we know that hormones play a huge part. We know that medical concerns and issues and diseases play a huge part. We know that medications. So, if you notice that your intimacy has declined or become different after taking a new blood pressure medication or taking any kind of new medication, making sure that you discuss those things with your doctor, because a lot of times there's a different medication that will still work for the problem you're having that won't cause those negative side effects that negatively affect your libido as well as your intimacy. So keeping all of that in mind when you're talking about intimacy, and then if you still rule all that stuff out, and you realize, it seems like it's just a lot of age. I've done my hormone replacement therapy. There are procedures that we can do that are affordable that will allow you to experience everlasting intimacy by increasing blood flow. And at Mibella, we offer several of those procedures. I'll talk about the ones for women, and Joseph can talk about them for men. But besides the hormone pellet therapy, and besides, your normal prevention and screening for women, making sure your GYN issues are all in order, making sure you're treating the vaginal tissue, as you age and mature, because that can definitely negatively affect arousal if your vaginal tissue is dry and you're not treating it topically with medications. But then also you can get to the point where you may need a procedure where you need the O-wave, where we use the sound wave technology to increase blood flow and increase lubrication and sensitivities. And it can help with some of your bladder symptoms. And then on top of that, you can do the O-shot. The O-shot is where we take your blood and we spin it, and we take all the good stuff from your blood and replace it into your clitoral area as well as your G-spot after significant numbing topically and as well with lidocaine or a block. Those procedures are tolerated. However, they're going to significantly increase sensitivity sensitivity for women, decreased laxity, so you feel like things are more tight and you can, feel the enjoyment more. You're more likely to reach your peak and enjoy it, and that can happen more frequently and intensely when you have the O shot. It also helps with leakage of urine with coughing, sneezing, jumping, laughing, as well as lubrication, and I already said sensitivity because of the increase in orgasms. And then we can always add with the O shot for women, we can add Hyalogel, which is made from the Wharton's jelly of the placenta. It's the best growth factors you can get, so it will just further enhance the result from the wave as well as the O shot, to help women with lubrication, sensitivity, increased orgasms, the intensity, as well as the frequency and other urinary symptoms. So for men, what does that look like, Joseph?
Same thing. It's the P shot and the hydrogel and the P wave. The same process is just put into both are into the genital areas. They both do the same thing for men they do for women.
But say it for men specifically, because it's a little.
No, it's the same thing. I mean, it helps with girth. It helps with stiffness. It helps with long-lasting erections. It helps with blood flow.
And sensitivity, because sometimes as men age.
Sensitivity, right. And then the hydrogel is the same thing. Sometimes we give those together. And it's platelet-rich plasma is your blood spin down, concentrated, and reinserted into the shaft and the tip area. Hydrogel is reinserted to the shaft area, which are the growth factors she talked about. Wharton's jelly from a baby's placenta, which is young genes.
So they work a little bit better than old genes. Yeah.
And then the same thing with the P wave with the sound wave technology. We're using the genital area to stimulate blood flow in the area
and regeneration of tissue.
Yeah, and the regeneration of tissue. And the one thing I want to say is these are not overnight products. Somewhere, I don't think we've ever said it was, but some people think they get this thing one time and they're going to be, and you can't even take Viagra one time and it works every time, so it's not, these are all natural products. We don't do any synthetic things in our business, from the hormone replacement therapy to the P wave, P shot, and all that stuff, all natural products, but it's not an overnight success thing. Just like our hormone replacement, just like the hormone replacement therapy, what I get in the pellets is different than what she gets and what any other man would get. Me and another man might get the same exact amount, but it's not because that's the standard. It's because that's what we need, So I want to make that
weight and age,
based on how we dose.
Labs,
based on how we dose. And so I just want to let people know that it's the same thing with the P wave, P shot, hydrogel, and that it's not. This guy come today, he gets a P shot, hydrogel, and a P wave, and all of a sudden he's back to when he was 20 years old. And this guy might come, he get a P shot, a hydrogel, and P wave, and he needs to probably have treatments and that we manage. But the only thing we ask is for a person to be honest with us so we can manage properly, that we manage throughout the process, because we want everybody, live well, age well, have everlasting intimacy is our motto. So we want everybody to be able to be intimate for the rest of their life. So you got to be honest with yourself and be honest with us, so we can treat you properly. Right. And and go back to being intimate, because this is intimacy for couples, right? Because we talk about the individual, but you got to be honest with your partner too, and your partner got to be honest with you, and treat this together, because this is a thing that we do for couples to please each other and be pleasing with each other, So and it's all we all can improve. So we have to manage it properly. We believe in having intimacy, and it's just really important that you understand as the person that may need the service. This is not an overnight success type of thing
for everybody.
Right. Not for everybody.
Right.
Right. And I'm gonna be honest with you. I'll be honest with you, not for no one, because everybody needs the maintenance throughout their adult life, their seasoned adult life. We don't have anybody that comes to our office and do it one time and don't come back and do it twice and don't come back and do it another time.
And
because sometimes it's just the P shot is given. The P shot is given once a year or every 9 months. So sometimes that person's coming back every 9 months to get that P shot. To
and then it may be a younger man who's getting it because he's noticed some changes, and he could go 18 months. So it's anywhere from every 9 to 18 months.
I wouldn't even do that.
But the hydrogels are anywhere from, for men, every 4 months to once a year. And it just really depends on the individual, their blood flow, their age, their medical history, all of those things. So that's what we like about it, is that we can individualize therapy for each person based on what they need and what they want. And everybody's not going to get the same treatment. You know, some people, in order to have great intimacy, may just need an O-wave for women, or VFit, and then it may be those women who need the full line to get to the level that they want with their intimacy. So just understanding that there's different options out there. You can experience everlasting intimacy. It does require the health and the prevention and wellness component, as well as a lot of these other great services that we offer that most people can take great advantage of and notice a huge improvement in their intimacy if they notice that they're already having some struggles. So that's intimacy for couples. You know, you can continue to have great intimacy. A lot of times that just requires you doing your total wellness, your hormone balance, as well as those intimacy services. But it's possible. And sometimes we have to delve into your history, figure out what medications you're taking, figuring out your history. You may have a history of, your prostate being enlarged for men, and women may have a history of diabetes. So all of those things play a role. But I think the exciting thing is that we can individualize care and create a specific treatment plan for you based on your needs, based on your history, and based on what your symptoms and struggles are. So again, it's Dr. Mia and Joseph at Me Bella Wellness Center. This is Ageless Intimacy with Dr. Mia and Joseph, and we're super excited to give this great information. If you need to schedule your annual exam as a woman for your gynecology, you can give us a call at 205-995-1009 or schedule online. I was actually supposed to be on vacation this week, and I'm not, so I have a bunch of open spots. So if you've been saying you've been trying to get into Me Bella and haven't been able to, you can go right online right now and schedule your appointment. And also, if you're interested in our other services, whether a man or a woman, including the hormone balance, the intimacy services, the weight management, the total wellness with supplements, as well as laser hair removal, you can give us a call or schedule online so that we can help you reach all of your wellness needs so that you can experience everlasting intimacy by living well and aging well. So we'll see y'all in a week or two for Weekly Wellness and Ageless Intimacy. I hope y'all have a phenomenal, flourishing week. Joseph, you want to lead us out of here with a health tip for the week?
Drink water.
Drink half your weight in ounces of water, and it'll keep you hydrated and satisfied. It helps with your skin, your detoxification, all the great things. So drink half your weight in ounces of water, up to 100 ounces of water, for better health. All right, we'll catch y'all next time. Y'all share this, please. Subscribe, follow, share, let everybody know all of this great information, because everybody doesn't know that all of these great options are out there, and we think that everybody should, so we can all live our best lives. We'll see you next time. Bye.